Good afternoon and good morning, everyone. Welcome to the second in ISWA's COVID-19 webinar series. It's great to see so many people join us from across the world today. I'm Daniel from ISWA, and I'm hosting today's webinar looking at the health and safety aspects of waste management during the COVID-19 pandemic. By that we mean health and safety of waste workers and professionals. We'll be joined by two leading international experts from the ISWA community from the USA and the UK, who will briefly discuss the topic, followed by a short Q&A with the audience. We appreciate we can't accommodate all time zones, so the recording of the webinar will be available very soon on ISWA's YouTube channel. All participants are muted, but we encourage you to type your questions in the tab to the right of your screen. And for this webinar, we do have a little more time left aside for the audience questions, so we'll endeavor to make it a bit more interactive today. So what is the topic of today's webinar? As much of the world goes into lockdown, the workload and pressure on the MSW industry increases due to significant rises in household consumption. Waste management has been classed as an essential public service in most countries, which means waste management professionals must navigate the health and safety risks related to the coronavirus. Though information about the virus is still evolving, ISWA, in partnership with our members in North America and the United Kingdom, will today discuss the latest guidelines and advice for the industry. It's essential that we ensure that waste workers, especially frontline collection and processing employees, are afforded maximum protection and remain safe from infection and can support communities in mitigating the spread of the virus. Before I introduce you to our speakers, I want to give a little introduction to ISWA, since many of you joining today are new to the association. First of all, I'd like to recognize our sponsors, Veolia, City of Rotterdam, Ecomondo, and Messe München. Thank you for all of your years of support, and we can't do this without you. And same goes for our Platinum members, of which there are too many to mention. And as I mentioned previously, this webinar comes to you for free, and we can't work for free, and we do count on the support of our members. I know there are many of you listening today who are not yet members, and I encourage you to check the link here, sign up, or contact me directly. I think this is a great time to join us, as we'll be offering more and more online content and making more of our knowledge more accessible than ever, no matter where you are in the world. And for those of you unfamiliar with ISWA, we're a global, independent, non-profit association working in the public interest to promote and develop sustainable and professional waste and resource management worldwide. We represent all stakeholders within the waste management industry and beyond. We consist of private companies, municipalities, universities and academics, young professionals and more. With representation in over 100 countries, we're truly unique and global. And with that, I would like to introduce you to our two speakers. David, can you please introduce yourself?
Hello, everyone. This is David Biederman from my room here in Vienna, Virginia. It's a pleasure to join all of you on this very important ISWA webinar. I'm the Executive Director at SWANA, the Solid Waste Association of North America. We're the largest association for the waste and recycling sector in both the United States and Canada. We represent both public and private sector folks. For those of you who don't know, I used to be the Safety Director at the National Solid Waste Management Association. And so I have a deep personal interest in improving health and safety outcomes for workers. And SWANA spends a large amount of time developing resources for employers and employees to make sure that they stay safe. As I'll discuss in my presentation, COVID simply adds another layer to those resources. I usually represent SWANA at the General Assembly in ISWA and have attended the last 5 or 6 World Congresses. I look forward very much to this webinar and sharing our knowledge with the attendees and hopefully answering questions as they come up. Thank you.
Good afternoon from the UK and good morning and good evening wherever else you are in the world. My name is Toni. I'm a senior lecturer actually at the Open University in the UK. But also for my sins, I'm a secretary for the Waste Industry Safety and Health Forum, which I'll explain a bit more about in my talk later. And I also chair the Chartered Institution of Waste Management Health and Safety Special Interest Group. So obviously I have a big interest in occupational health and safety, specifically in the waste industry.
Thank you, Toni. Thank you, David. So jump straight in, and David, the floor is yours.
Thank you very much, Daniel. And again, hello to everybody. I'm thrilled to have this opportunity to speak to this international audience of hundreds of solid waste professionals, not just in the United States, 75 countries around the world. Let's get started. So as I mentioned, SWANA is a very large association. We have 47 chapters in the United States and Canada, and as well have a chapter in the Caribbean and a new chapter in the Pacific Basin. Our core programs at SWANA, since many of you aren't familiar with our organization, focus on education, research, advocacy, and safety. And our overall mission is to, or our goal is to seek to improve the professionalism and image of the industry while moving the industry from treating waste as something that you dispose to treating waste as a resource. That's not the subject of today's webinar, but is a critical part of our mission. So SWANA really early on recognized the very significant and transformational nature of the COVID-19 pandemic. We were starting to develop resources in February before the United States and many other countries started to close down in response. And we pivoted rather quickly to helping our members, helping employers, helping employees adjust and respond. And I actually joke that before COVID, we talked about National Sword and recycling almost every day. We don't talk about National Sword that much anymore. We're talking about COVID every day. But it's so important from both a public health as well as a personal health perspective for individuals that it is an important subject for us to be talking about. So what were the first 4 things that we did? Well, we needed to persuade governmental authorities in the United States, both the federal government and state governments, to designate the industry as essential. We then, once we were successful at doing that, we needed to provide documentation to workers in the industry that would allow them to show that they're essential. So when you're out on a refuse truck collecting the waste, it's obvious you're in an essential industry. But what if you're driving in your car to a waste facility at 4 in the morning to start the route at 6 in the morning, and the police pull you over and say, "What are you doing out?" You need to have something that shows that you're in an essential industry, and we provided documentation that would allow workers to do that. We developed a new website, really a web page on the SWANA website for all of our COVID-related documents, communications, and news updates. And then, much like ISWA, we began to hold weekly webinars on COVID-related and other subjects, and have been doing regular outreach to our members so that they're informed about this dynamic, evolving, and candidly sad situation. In recent days, we have been working with the Federal Emergency Management Agency, FEMA, to prioritize our industry for personal protective equipment. Obviously, healthcare providers and certain other workforces are getting top priority, and we recognize that. But with our industry, it's really important to make sure that everybody in the solid waste sector has the right level of PPE to do the job. And we're also having conversations with FEMA as recently as this past Friday about whether our industry should be eligible for reimbursement for some of the excess or increased residential waste that has been collected since people have been staying at home, as well as what happens if you're providing service to a customer who goes bankrupt or otherwise doesn't pay. We're working closely with many other organizations. SWANA has limited bandwidth, and so we've been working with the United States Environmental Protection Agency to get messages out, particularly on Earth Day, with ISWA, the Scrap Recyclers, Keep America Beautiful, the Recycling Partnership, and others. And although recycling is not a central part of this presentation today, some of our work has been around educating people about the importance of recycling more and recycling right during this pandemic. Part of that has included outreach to the media about the various changes that we've seen in programs as a result of the pandemic. There have been a lot of changes in the United States, and all of this information is put on the SWANA webpage, which you can see there on the screen. And you should know that ISWA's COVID-19 guidance is also located on that webpage, because that reinforces something that I hope I can convey today, is that SWANA doesn't have all the answers. And what we do is we try to be a facilitator and an organizer of information, knowledge, and subject matter expertise that allows the industry to perform better. So let me now turn to safety, specifically in worker safety. And this may be the most important slide in my presentation. SWANA's basic goal here is to reinforce the guidance that are coming from the authorities on the impact of coronavirus on people in our industry. So we're reinforcing what the Centers for Disease Control, the CDC, is saying, what the World Health Organization is saying, and what OSHA is saying. And solid waste is not an effective vector for the transmission of the coronavirus from one to a person. Getting it from somebody else by being within 6 feet of that person is the way that we need to be aware of when we're at our work, whether it's collecting trash, recycling material, or at a disposal facility. The Centers for Disease Control, CDC, just late last week issued a new fact sheet, a waste-specific fact sheet that is on our website, titled What Waste Collectors and Recyclers Need to Know About COVID-19. And it reinforces many of the messages that you see on the sheet on the left side of my slide and on our webpage. Specifically, it confirms that collection workers should be protected from COVID if they're wearing the appropriate PPE, such as gloves. Now, the reason for that is because there have always been pathogens or needles in the trash, unfortunately, and workers face a risk of contact with those materials that can cause them to be sick. And so that's why PPE is so important in the pre-COVID era, and is particularly important now while COVID is in the waste that's being generated. We have had some state and local governments in the United States require facial coverings for essential employees. So that would include the waste sector. Other states have been recommending facial coverings, but coverings, but have not required them. So there's a variety of opinions about whether or not facial coverings are needed. So what is SWANA doing? We're urging employees to provide the right level of PPE, to modify operations to provide social distancing, to remind their employees, frankly, about social etiquette around sneezing, washing hands, staying clean, and then implementing changes in their collection crews or elsewhere if someone is sick or someone in the worker's household is sick. And I'll expand on that in a moment. We also have been talking a bit about the public's role in protecting solid waste workers. One of the byproducts of the coronavirus pandemic has been a very significant increase in the amount of residential waste and recycling. And so we're explaining to homeowners what they need to do to protect our solid waste workers. And that includes making sure that waste materials, trash is in containers or closed bags. We don't want loose tissues or wipes used to clean down something to impact the workers. We don't want them touching that. All recyclables should be in a cart or a container. We don't want people touching loose cardboard on the curb. There was a study that came out from the New England Journal of Medicine in March that indicated that the coronavirus can live on cardboard for up to 24 hours, which caused some concerns in our industry. And so the picture you see on my slide is not how we want people putting their cardboard out on the street. We've also urged the public to delay their spring cleaning. And I will admit that this has not been the most successful communication that we've done, as people at home with a lot more spare time are spending a lot of time cleaning out their attics, garages, and basements. And this is generating a significant amount of material that has stressed the system to some extent. We're also communicating the importance of not taking the gloves and masks that people are now wearing, and when they're finished with them, throwing them in the trash. We want them thrown in the trash. We do not want them in recycling, because that material, even though it's mostly made of plastic, is not recyclable in curbside. And unfortunately, what we've seen a lot is this. We've seen a lot of people throwing away gloves and masks on the street, in parking lots, in the park. And this is bad for public health and the environment. And frankly, it's just the wrong thing to do. And so we urge people to please take the extra 15 seconds that it takes to take your trash can. As I mentioned, very visible in the media, communicating around these various health and safety issues, talking about the fact that in the first month of the coronavirus outbreak, between March 15th and April 15th, there was a very significant uptick in the number of collection-related fatalities in our industry. We had 18 fatal incidents in 30 days, excuse me, in the United States. Fortunately, since we issued that announcement, over the past 30 days, we're aware of only a single fatal incident involving a garbage truck. So we're hopeful that that more positive trend continues in the coming weeks and months. Again, we've been speaking to the media about this at great length, and have continued our outreach because we think it's really important to engage the general public to keep our workers safe. So now let me speak for a few moments about different lines of business. On the front line in collection, for example, employers need to make sure that they're providing their workers with, again, PPE, hand sanitizer, and wipes, so that when they're on the route, they have the ability to keep their hands clean and reduce the possibility of contamination. It's important to clean the truck daily. And what that means is inside the cab, the places that are high touch, such as the handle on the door, the steering wheel, knobs, control panel, buttons on any digital systems that are in the truck, those need to be wiped down every day at the beginning of the shift and at the end of the shift. Most employers in the industry are no longer holding drivers' meetings where they bring all the drivers together at the start of the day to talk about various topics, including safety. Those communications are happening digitally or happening in a parking lot or some other location where people can be socially distanced. Lunch and break rooms are a place where people in our industry often congregate, and obviously making sure that workers are not congregating too close to each other is important. And so we've seen a lot of organizations break up the seating in their lunchrooms and their break rooms to ensure appropriate social distancing. We're trying to minimize worker interaction between shifts. So there may be a shift at the recycling center from 2 p.m. to 10 p.m. and then at 10 p.m. the next shift comes on, and the people in the different shifts talk to each other. How are you doing? How's the family? We're trying to minimize that interaction to reduce the opportunity for cross exposure. And then, of course, in a truck, I'll be honest, it isn't easy for the helper and a driver to maintain 6 feet of separation. And so we're seeing some efforts to reduce the amount of time that a helper is in a cab of a truck. And in some places in the United States, supervisors are actually driving the start of the route, and then the helper can be on the riding step while the truck is moving. And then at the end of the route, the supervisor comes out and picks up the helper. Again, the idea is to minimize the interaction between the driver and the helper in the close confines of the front of a truck. And we expect that both the driver and the helper are wearing facial protection if they're together in the cab. At recycling facilities, there have been a number of operational changes that will provide appropriate social distancing. Unlike collection, which is continued in all parts of the United States, there have been a number of facilities that have actually closed that perform recycling. They closed because they were unable to provide sufficient social distancing between workers. But most facilities have been either installing plexiglass separators between the sorters or pickers on the line, or they're separating the pickers so to make sure that they're more than 6 feet from each other. And as you can see in the picture, some companies are providing facial guards to further protect workers in the event that there's some small amount of coronavirus on something that they're handling. The irony of the facilities closing at a time when recycling pricing, commodity pricing, is actually going up is ironic. Paper mills in the United States are asking for material. When the commercial sector shut down, a major source of recovered paper, of clean recovered paper, was lost. And so it's our hope that as the United States returns to something like the new normal, we'll see those recovered paper sources in the commercial sector be available to recycling facilities. Disposal facilities also pose a number of hazards and challenges. When a waste hauler or a private citizen goes to a disposal facility, whether it's to dump a truck or to bring some boxes of household hazardous waste or other material, usually there's an interaction at the scale house. And to reduce the potential of exposure to the scale house attendants, they're eliminating the use of cash. They're not requiring signatures on documents and taking other steps to make sure that there's as little interaction with customers as possible. At drop-off centers, where people go to drop off various types of material, such as glass or books or batteries, those facilities have seen a significant increase in the number of customers that they're getting. There's a need to keep the customers 6 feet apart from each other and from the staff. These facilities are urging people to wear masks. Some people are not happy being asked to wear masks. And one of the facilities that I'm familiar with in North Carolina actually had a higher security to maintain distance and enforce their rules. And the fact that curbside recycling collection has been suspended in several communities in the United States is adding to the burden at the drop-off centers. So looking forward, SWANA believes that we're past peak residential in the United States. Businesses are beginning to reopen. People are very slowly beginning to go back to work. And it's our expectation that this is going to continue, and we'll see a decrease in the amount of residential waste and an increase in the amount of commercial waste being generated. But in the United States, there's going to be great variety by geography, by location, in how quickly the new normal occurs, and also what it looks like. When the new normal comes back in New York City may be very different from what it looks like in Topeka, Kansas. And nobody really has a good crystal ball that's working well that can tell us what's going to happen 3, 6, or 9 months from now. And if anybody does have that crystal ball, if they can email me, I would love to get that crystal ball for future reference. But some of the things we're looking at is, will all frontline waste workers be able to get access to testing? What are the mental health challenges that frontline workers are going to face, given the past 2 months of very intense work, particularly on the residential side? And when offices come back to work, how are those offices going to reopen? And what things are going to be done differently in office settings to make sure that people stay safe? This is all going to occur in a backdrop of significant economic and fiscal changes that are going to impact how operations are performed and how services are provided. We're developing some guidance for the industry around recovery planning and the new normal, and we will be presenting that at our virtual conference, Virtual SWANApalooza, that takes place on June 22nd through the 26th in the afternoons Eastern time. So there will be more information about that coming to all of you. The last thing I want to just briefly mention is one of the very few positive things that has come out of the coronavirus pandemic has been the recognition of the solid waste industry as an essential workforce. And GLAAD, the company that makes the ubiquitous trash bags, approached SWANA and asked if we would jointly develop a fund funded with money provided by GLAAD to provide financial assistance to frontline solid waste and recycling workers. And so we are currently administering a fund that for people who have tested positive in the industry for COVID-19, if they were laid off because of COVID-19, shutting down business operations, that they were a front-end driver, or sadly, if someone in the industry was a frontline waste worker and passed away, we're going to be providing some money to the immediate family of that individual, minor children and spouses. And so we're very proud to be administering this program, which we received over about 100 applications in the first 10 days. And we hope to start distributing money later this month. Just so I'm clear, to be eligible for this program, you need to be a frontline solid waste and recycling collection worker. So that's a driver or a helper. It's our hope that when this money is distributed, we'll be able to distribute additional funds to others in the industry, such as maintenance and mechanics, supervisors, and others who have also been impacted this way by COVID. And GLAAD has been supporting this effort, not just financially, but through a national advertising campaign. And I hope that you'll have an opportunity to see this advertisement now that's been playing on national television during the month of May here in the United States. So we're very proud to have that advertisement running in the United States. It ran last week. It's going to be running again next week. We've been telling our members in the United States which programs it's running on. They seem to have chosen to take advertising time on all of the late night talk shows like Jimmy Fallon and Jimmy Kimmel, which I guess is a good thing. And again, I want to thank ISWA for the opportunity to speak today, and we'll be glad to answer questions at the appropriate time. Thank you.
Thank you very much, David. There are a lot of questions coming in, but we will leave that until the end of the, we'll let Toni speak first. So Toni, the floor is yours.
Thank you very much, Daniel. So I'm going to talk a little bit now about the UK experience of dealing with the pandemic. Basically, waste management is seen as a high-risk industry in the UK and has been for many years. So we have quite a few fatalities and illness and injury per annum, which I won't dwell on too much now. But since around 2001, 2002, we've had something called the Waste Industry Safety and Health Forum. And this is basically a partnership between the waste industry, the regulator, which is the Health and Safety UK, various professional bodies such as the Chartered Institution of Waste Management and Environmental Services Association and others, basically to come together to deal with the issues that arise in waste management. Because it is one of the highest risk industries in the UK. We have a website, which I'll just direct you to now. It's signposted as well from the regulator and from the professional bodies, and is supported by the Health and Safety Executive, Environment Agency, Fire Resource people, and is sponsored by the Chartered Institution of Waste Management. So that has guidance on all sorts of issues in the waste industry. Basically, we have a long history of developing guidance, and the commonalities of all of our guidance is actually written by people who do the job. So it's not me as an academic, it's not the professional bodies, it is people who are at the coalface, as it were, who are delivering the recycling or the collection, whatever it is, operations. It's best practice, it's not compliant practice, it goes over and above in many cases the legislation. It contains hints, tips and advice and case studies, and it's continually updated as knowledge changes, and we develop new guidance all the time. So we were basically in a good place to deal with this new emerging problem, if you like. So yes, the current pandemic, it did throw up some new challenges for the waste management industry. Waste is seen as a key sector here in the UK. It couldn't stop like a lot of other industries because it has strong public health reasons to continue. So we had to find ways in which it could safely continue for the workers. And there were specific issues, which I'll go to in a bit more detail in a moment. But the big one was, how do we maintain the safety of the workers with social distancing guidelines and other issues that were coming to the fore? How could we control exposure of workers to the virus? That was the question. What looks like good hygiene for the workers? How do we implement social distancing in things like vehicle cabs? Which activities put workers at risk? As David mentioned earlier, there was quite a few studies coming out showing survivability of the virus on various materials such as plastics and cardboard of between 24 hours and 72 hours. And also, what does good PPE look like and when should it be implemented? And also, it wasn't just in one part of waste management, it was pretty much everywhere. It was from waste collection, it was the use of vehicles, recycling plants and composting plants and those kind of things. It was handling the materials, it was during maintenance. There's a whole plethora of issues that were coming to the fore. And basically, we were coming to a point where waste management was at risk of stopping because of the worries of the workers and some of the employers. So we basically had a very short time frame to sort this out. We were asked on a Wednesday morning if we could do something, and luckily, as you might say, I had something I prepared earlier, which was from a good colleague who used to be health and safety director of a very large waste management company, had previously drafted something, so we took that And 48 hours later, we had our COVID-19 and waste management activities leaflet in its first draft. So we released it for comment on the Friday. We had over 60 consultation responses back by the Tuesday afternoon. And so a week after we first was asked, an official document was out on the WISH website, which you can see the link to the latest version there. Of course, it wasn't static. We've revised it 4 times now, and we're currently, today even, we looked at the 5th draft. So it changes as the information changes and as the situation changes. We've updated it. So what's the principles of the information sheet? Well, official guidance takes a lot longer to publish. So we were able to get this out very quickly at the very beginning of the pandemic. And basically, more or less, the governmental guidance has only been released in the last 7 to 10 days. So this was going for about a month before any other official guidance came out. So it immediately helped the waste management industry. The important thing is we did not seek to counter any of the official public health guidance. In fact, we took it and distilled it into a practical format aimed at the industry so they could understand the plethora of information that was available to them. And we specifically dealt with waste issues and helped with interpretation. So they were not expected to try and go away and read 1 million government documents. Everything's here, and we refer out where necessary. So we don't aim to solve the whole issues of all the pandemic, but what we do is point to other information sources, a bit like SWANA mentioned earlier. So I think the important thing is, as well, we were dealing with specific situations. So the big thing that came out at the very start of the pandemic was, how do we deal with social distancing in cabs during waste collection activities? That was the thing that was causing the most concern, should we say. So the official guidance is 2 meters or 6 foot, which obviously is very difficult to achieve in a vehicle cab. So basically what we advocated with WISH was to take a hierarchical approach. So in other words, you would look at the situation or the collection round and you say, okay, could it be stopped for starters? If it's a commercial collection, maybe it could. If it's a household collection, probably couldn't be. So if that can't be stopped and it can't be run by a single person because of health and safety or other issues, could you then think about transporting people separately to the collection point? And some local authorities in the UK have taken that approach, where they have individually taken collection operatives to the curbside, and the driver has gone there separately. So other solutions might be screens within the cab. So we've got guidance on screens, because obviously you can't just stick a piece of material in a cab and expect everything to be the same. There are health and safety issues. You have to assess the safety of the screen and the material, whether or not the driver can see through it, whether they can get out of the vehicle safely if there's an accident. So there's a whole pile of things to think about. You can't just sort of stick these things in and walk away and think you've solved the problem. And also screens are okay for if somebody sneezes and it's the initial, protects against the initial projectile, if you like, but it won't really stop an aerosol from circulating in a cab. And there's been quite a lot in the media about viral load and longer term exposure to viral load, which is why we've got concerns of health workers. So then we move to things like opening the windows, making sure there's a good airflow and all the rest of it. PPE, I will deal with that a bit more in a moment, but obviously everyone was concerned about what do we do with PPE. So a bit like SWANA, we said, okay, if you're collecting materials or handling materials, then you should have either a waterproof glove or nitrile or something like that underneath a cloth glove. Basically there's a safe way of handling the materials. But we also reminded employers that they should be providing cleaning supplies. So when people swap vehicles, which happens quite a lot in the industry, things like steering wheels and indicator stalks and all the rest of it are cleaned in between different drivers. And you give the hygiene supplies to the workers. So if you need to do the cleaning, or if they need cleaning, that they have that provided and a method of disposing of it. So all of this is on top of normal operational requirements. So we also reminded people that, yep, you have to do all these new things very lightly, but don't forget your fundamental health and safety issues, because, you know, we still are an industry where there's quite a lot of accidents and illness and injury, and we don't want that to increase because you've taken your eye off the ball and you're worried about new things. So we're reminding people to make sure that if any of these things are brought in, they are actually properly risk assessed as part of the operations that the workers are expected to do. So we also have some specific questions which have become more important as the whole situation has developed, and one of those is, in particular, should we be giving employees face masks, particularly when social distancing is difficult. And this has kind of got a little bit confused, if you like, by using face masks and face coverings almost as if they were the same thing. So in the latest version of our guidance, we will be addressing this in a little bit more clearer fashion, because face coverings and face masks are actually two very different things. So it's a difficult question to answer as well, as to whether we should be providing them. Basically, our approach is any supply must be based on risk assessment. So FP3 masks, proper face masks, are recommended for healthcare workers here in the UK, but probably not as a default for all other workers in all situations. There are many reasons for that. Mainly because over a long time period, you can't expect someone like a waste collector to wear a mask all day, because that's unrealistic, because what they do is a very physical job. And we're also very concerned that people don't over rely on the right mask and they think they're safe. And there are other things that face masks can do. People adjust them all the time. They stick their fingers in them, they pull them on and they pull them off. You know, they go to have something to eat and take them on and off. So there are issues that if you're providing that kind of safety gear to workers, that you have to think about. So yeah, we will be defining in our new version of guidance things about like face coverings and face masks, because one is really to make people feel safer, whereas the face masks are actually for health and safety performance, and they have to be used, stored, replaced and disposed of in a certain way. So there are issues around how we deal with those. So we also had some of the similar issues that David mentioned. Basically, initially some collection fractions were discontinued here in the UK because we were worried about worker absence. And in fact, there was quite significant worker absence at the beginning of the period, and some people reporting even up to 50%. However, the latest information that we have anecdotally is this has gone down significantly, and we're seeing absence rates similar or even in some cases lower than pre-pandemic. So that's kind of gone away a little bit, and mostly those kinds of fractions are now starting to be collected again. Waste volumes have increased. People, when they're at home all day, they do clean out their cupboards, they do their spring cleaning, and in the last couple of weeks it has become pretty important in the UK to open up our household waste recycling centres. This has caused a few issues. So the government has said there's no reason in law why they can't be open, but we got some initial reports of basically slight chaos when they did first open. Very long queues and people not social distancing, and basically a lot of difficulties for the staff and for the waste volumes. So in the WISH guidance, we've also covered things like having one in, one out, alternate parking bays, pre-booked slots, and ensuring protection of staff. So that's also something. Basically, so we're committed to updating the information as we go, and to help the industry understand the implications of the current issues that are happening, but also to improve the perception of the waste industry as a benefit of to society and a safe place to work. We know in the last couple of weeks that the waste industry, the workers are entitled to testing as key workers, and we know that there are likely to be other changes in terms of waste volumes and things like that as time goes on. So we're continuing to look at that, and we're continuing to address that. So if you're using or looking at the guidance that we've produced, then do keep checking back, because we do update it every week to 10 days. And thanks for that.
Thank you, Toni, and thank you, David, both for your really interesting talks. So we've got now we've got 15 minutes left for Q&A from the audience. So please continue asking your questions in the question box, and we're going to get through a few now. This first question is for both of you. It comes from Ruben in Nigeria. You both refer to waste management as one of the most high-risk occupations. Do your respective countries have a testing regime in place for frontline workers for COVID-19? And do you think they should?
So this is David Biederman. There is no specific protocol for testing workers. As I mentioned, presentation, though, the waste sector is designated as essential critical workers. They should be able to receive those tests to make sure that they don't have the virus. And as it's more prevalent in the United States and hopefully in other countries will, governments will be able to provide testing to all waste workers throughout the world. But it's going to take time before that, unfortunately.
Thank you. Toni?
Waste management workers can request a test in the UK because they are listed as key workers, but it's been a little bit hectic, I think, with the testing here, and sometimes they've booked up pretty quickly, but I think that's probably settling slightly now. But yes, they can request a test.
And what kind of numbers are you seeing at the moment in terms of infections in the industry?
I don't have any data on that at the moment, but we anecdotally, we have not seen any clusters or any sites that have had a large number in one place, to my knowledge. We're going to obviously look into that a little bit more detail over the coming weeks, but certainly amongst the big member ISWA companies, they're reporting that they haven't had any sites shut down because of cluster or anything like that. So.
Okay.
So in the United States, there's been probably close to 1,000 people in the industry have tested positive. We don't have precise numbers, of course, because that's confidential information from a health perspective. But based on our conversations with members and others, we think the number is around 1,000. The New York City Department of Sanitation alone has had close to 500. They've been very public and transparent in revealing their data. And I've been having frequent conversations over the past month and a half with large and small companies, as well as with government agencies around the country. And unfortunately, several people who work in the solid waste sector have passed away from the coronavirus. Although, number one, most of those were not frontline workers. So we've seen supervisors and mechanics pass away primarily. And also, there's no indication with any of the fatalities that have occurred, at least any information that I'm aware of, that the person was exposed to COVID because of the waste or recycling. It appears that the exposure occurred from somebody else outside that person's workplace.
Okay, thank you. I think this question also applies to both of you. You both spoke extensively of PPE. What approach are you taking in terms of use and replacement of PPE? And what frequency do you suggest PPE is cleaned or even replaced to avoid any risk in terms of viral charge?
Basically, we're saying where you've used PPE in the past, and whatever frequency you had it in the past, it should remain the same. Because waste management is an industry that has bioaerosols in any event. You should have already taken that into consideration. And any PPE you're using and any frequency, you should continue that. So we've not suggested anything special or new for COVID, and doesn't seem to be any reason why the virus is any more hazardous than many other bioaerosols that the industry is already exposed to.
Yeah.
That's a great question, and Toni, you gave a terrific answer. We have not developed any guidance for the industry regarding the amount of time or amount of uses that PPE should be used before it's either sterilized or disposed of. The only advice that I would add to what was just said is you should be following the manufacturer's guidelines about use. Different types of materials are able to work in the way they're expected to for different amounts of times. And so I think following the manufacturer's guidance is really important, particularly involving coronavirus.
Okay, thank you, David. This question comes from Rich, a New Yorker, and I think it's for you, David. He says that right now we're having workers ride in cars together to the same pickup site. How can we protect staff riding in the same trucks together?
So if workers are going to be in a vehicle together, they should be wearing facial coverings and gloves, and the vehicle that they are riding in needs to be sanitized before it's used for that purpose. So wiping down the door handles, wiping down the seat. The employee needs to make sure that he or she is not touching anything. And if the person's wearing a facial mask, as Toni mentioned, there's a little bit of a tendency to touch the face because you think you're protected, and they need to be reminded not to do that.
Okay, thank you. And that leads on to another question that I'll give to Toni. Have there been any studies published regarding the effectiveness of various types of screen installed in cars or cabs?
Oh, no, studies, no, but I think there's been studies published on the transport of the aerosol, because it's basically transported in droplets. The screen might stop an initial sneeze, but it wouldn't stop it if it was circulating in the cab, because it's not going to be airtight in any event. So I think if you are using those kinds of things, you should still do other things like keep the windows open and reduce the amount of people that travel together if possible, and all those things.
Okay, thanks. The next question comes from Jane Gilbert in the UK. She says that as the virus is primarily transmitted in droplets and aerosols, to what extent can some of the lessons learned in the UK composting sites and reducing worker exposure to bioaerosols be translated to the virus, or are the particles too small? I guess this is also for Toni.
Well, yeah, it's a tricky question. Yeah, as I mentioned earlier, the waste industry should know about bioaerosols, because we know about them. We have done for many years, and there's been a lot of work done in particularly composting in that area. Yeah, viruses are similar, but obviously the size of the aerosols are possibly smaller than some of the particles we normally deal with. But things like survivability in the environment and transport and all of those things are probably pretty similar. So if you're taking good precautions because of the risk of aerosols, you're probably taking pretty good precautions to the risk of COVID.
Okay.
So.
Thank you very much. We've got a few minutes left, so I want to give you both a moment to give a kind of concluding statement. I want to just ask you both to mention maybe for a couple of minutes what your key takeaways are, and maybe mention with some positive words why you think the current situation will benefit our attitudes towards waste worker health and safety. Who wants to go first? Toni?
No, David.
I was going to be polite and say ladies first, but okay. I think the only real positive that's developed out of this is the increased recognition that the waste sector is receiving as being critical, as being emergency responders to some extent, and deserving the respect that we give to firefighters and police officers. And the reason that has happened is because people in their homes are seeing all this waste being generated and putting it out on the curb, and that isn't usual, and seeing it taken away by trucks. Normally, when the garbage truck comes to your house, you're not home, you're at work. And so the fact that there are these people out there every single day performing this essential service when you're told to stay at home has been a way to reinforce the importance of the industry. I think this in the long term will benefit the industry on a number of levels, but in the short term, we will continue to have challenges around reducing exposure, because unfortunately, the virus is, although I'm not a medical professional, it's very contagious compared to other things. It spreads easily. At least some component of the virus can live on cardboard and metal for a while, although my understanding is that there are other studies that seem to indicate that the fact that there's a trace amount of the coronavirus on a piece of cardboard doesn't mean that that coronavirus on cardboard is sufficient to make the person who touches the cardboard test positive. So we need further information about that, and we're still, unfortunately, just in the starting the third month of the stay-at-home response to the pandemic in the United States and Canada. And studies have only just started. And what we need to do is continue to rely on the information that we're receiving from leading authorities, whether they're government agencies, SWANA, ISWA, CIWM, and others, and make sure that we're communicating to the public as best we can and as often as we can about what the role they can play to help keep these workers safe. And if this is the last thing I'm going to say, I want to thank ISWA at this time for allowing me to participate. If anybody who's listening to this, participating in this webinar, has any questions and we didn't answer them, my email address is dbiederman@swana.org. It was on the first slide of my presentation. I would be honored to hear from you. Thank you very much.
Thank you very much, David. Toni.
Very similar, actually, and surprisingly, I think that the importance of waste management in such a situation as we find ourselves in has been obvious, and the key workers that have continued to work through the pandemic, you know, in the current situation has been amazing. I think we should clap those workers because, you know, basically they've worked and kept our public health systems in good order. So yeah, obviously the industry itself has performed very well, I think, in the face of what's happened. If you watch any of the big films like Contagion, the one thing you notice is all the rubbish on the streets, right? So that's not happened. So it's been, you know, the work that everyone has put in to make this work has been fabulous. I'd also like to thank all my compatriots on WIDGE who have met regularly, and there's 5 of us in a little group, and I won't mention all their names, but if it was not for them and for their expertise in the industry over the last 20 odd years, then we wouldn't have had such a good response, I think, to getting information out. And yeah, and I'd like to thank ISWA again for inviting us to take this seminar, because it's an important subject. Health and safety often is forgotten, so I think it's great that we are, you know, flagging it as an area of interest internationally. So thanks everyone, and if you have questions, by all means, my contact details are also in the presentation. By all means, drop me an email. Thanks.
Okay, thank you very much, both of you. We do have a few more questions in the tab that we will try and answer after the recording, and when we circulate the recording, sorry, especially some on informal waste sector workers, which might be really important to answer. But we're out of time for today, so I'd like to say thank you very much to our excellent speakers, and thank you to everyone who joined us from around the world today. You'll receive the recording of the webinar soon, and don't forget to check ISWA's COVID-19 information page. The link is on the screen right now, and it will be on the PDF which we circulate. So thank you and goodbye.